is a 6-year-old child is brought by the ambulance to an emergency department after a house fire where they were trapped in a smoke filled room for several minutes. And they did not lose consciousness during this event. The emergency medical services team arrived, administered oxygen before the transport, and the child has been coughing and is reporting that his throat hurts. Um, in the emergency department, the child's temperature is 37. I guess that's okay. Heart rate is 132 beats per minute for a 6-year-old. That's slightly elevated. Respiratory rate is at 30, also slightly elevated. Blood pressure is at 102 by 68, and oxygenation saturation is at 94%. And there are small blisters on their cheek. Their eyebrows are singed. No soot is seen around the nares or in the oropharynx. The child has stridor and is coughing. On lung examination, there is good aeration bilaterally, but there are scattered wheezes. There are no rales, and there is no sign of respiratory distress. The remainder of the physical exam is also completely normal. Which is the best next step? Okay, so I would like to remind you that the child is wheezing and he is saying that his throat is hurting and was in a room which is filled with smoke. So, what would you start with? Would you administer a dose of nebulized racemic epinephrine? Would you admit him to provide him 100% oxygen and monitoring? Would you obtain a chest x ray or would you immediately intubate? So the best options, let's start with the first one. If you give him nebulized racemic epinephrine, it will address the upper airway congestion, but it will only do that temporarily. This child is wheezing, so obviously the smoke has probably reached the lungs, and the smoke or the soot that can always trigger excessive inflammation, which can lead to airway collapse and lead to surfactant deficiency as well. In certain terms, it could just lead to alveoli rupture too. So, keeping those things in mind, because racemic epinephrine would only address the upper airway congestion, we wouldn't indicate it as the best suitable option. Admitting him for monitoring and 100% humidified oxygen, I mean, he should already be getting oxygen, but would that be the best next step in treating this child? I mean, that will not address the overall inflammation and the risk of airway collapse here. Obtaining a chest x-ray will basically not provide you any diagnostic benefit. He's already wheezing, you can appreciate that. So that means the soot has reached his lungs. It's not going to make much of a difference here by obtaining a chest x-ray. The last option, which is performing an immediate endotracheal intubation, is the best option because in children with, again, damage to their lungs and damage to their upper airway due to burn injuries, the inflammation can so rapidly alleviate to a point where it leads to damage and it leads to sudden collapse and compromise, that your best bet is intubating the child and just observing them later on. So the right option would be endotracheal intubation.